Hello, guys. Welcome back to another YouTube video. Yeah, I am Kenny, also known as Nurse Designer, and today I have a special guest. I would like her to please introduce herself to everyone.
Hi guys, so my name is Rosemary. I'm a nurse from Ghana and I moved to the UK. I worked on the ward for quite some time and I'm currently working in clinical research as a clinical research nurse. Yeah, and I'm happy to be here to be sharing this with you. Thank
Oh,
you.
thank you so much. I
Thank
would I
you.
would start by saying thank you very much for coming to my channel. Thank you
You're
for
welcome. Yeah.
granting this request. And today we are going to be talking about clinical research nursing. Like it's
Yeah.
been I do hear of people saying that they are in this specialty, they are a clinical research nurse, but we really do not know the rudiments, like how do they get to that position? How do they become a clinical research nurse? So that's why have have Rosie here to tell us something about that. So please, do you mind telling us how you became a clinical research nurse, please?
Okay, thank you. So, I was like I said, I was actually working in trauma and orthopedics, and then I moved to the UK. When I moved to the UK too, I was working in trauma and orthopedics, and it's quite very busy in trauma and orthopedics because we have all of these patients who have needs, especially with moving and handling. So aside all the other things, giving oral medications, lots and lots of antibiotics every time, you have to help everyone with moving and handling, basically with everything that they do. So at a point in time, it was very hectic and I felt very stressed. And I was like, okay, I don't think that I want to be doing bedside nursing for the rest of my life. So I need to find a specialty that I can be doing. Yeah. And I have always had an interest in clinical research because I used to see some of the nurses come to the ward to see some of the patients who were in research studies and all of that. Yeah. So I saw this vacancy in my trust intranet and then I applied to the job. And then when I applied, I was shortlisted for the interview and then I got the job. But when I got the job and I realized that there were some things that I could have done before landing the job. So there's something we call the good clinical practice. It's a course that you have to take from NIHR website. So NIHR is the, let's say, like a body that is responsible for all the research studies that is being done in NHS hospitals. So they provide the funding. So before you can carry out a research, you need a sponsor. So the sponsor can be a pharmaceutical company, it can be NIHR. So they have to pay for the funding. Yeah. So that course would give you a certificate. And without that certificate, you cannot work in clinical research, not even a single day. So on my first day as a clinical research nurse, I had to take that course. I spent the whole day doing that course to get the certificate. And I realized that I could have done that course before starting the role. Yeah. So if you want to work in clinical research, first and foremost, you'd have to do that course. You can register on the website and then you take the course and then you get your certificate. And the certificate is valid for 2 years anyway. Yeah. So basically, that was it. But aside that, you should be someone that you know that you are very skillful with cannulation and venipuncture, and then you are skillful with ECG and interpreting ECG as well. So when we do ECGs, there's another app we use to do conversion, Federica Report. It will tell you about the PR intervals and the QTC and all of that, which is called Muse. Yeah. So you have to also be very abreast with like what type of ECG you have, whether it's an AF or whether it's let's say atrial fibrillation or maybe an atrial flutter, you have to know like what it is, because the thing is, clinical research is basically about like giving, mostly it's about giving medications which do not have a license, because they are mostly like trial medications that we give to participants. So it can be like healthy people, or it can be participants who are unwell for maybe a kind of disease that they are trying to find the cure. Yeah. So it can be that you are giving tablets, or you are giving like intravenous infusions. Yeah. But then they do not have a license. Yeah. So we have what do we call it, guidelines that we follow for every research study that we are doing, and we call it the flow sheet. So it is based on the study protocol from the sponsor. So sometimes a research can be like a private one, a commercial one, or maybe it is non-commercial. Non-commercial is maybe some a research that is sponsored by NIHR and NHS research. And a commercial one can be like from a pharmaceutical company, maybe Novartis, maybe AstraZeneca, GSK. There are lots and lots of pharmaceutical companies. They mostly are like the sponsors. Yeah. So they bring this medication. The medication did not have a license, so we give it to people that we like. It's more like trying it on people, and then
Yeah.
we observe them. Yeah. So it really depends on what the protocol says. Maybe we have a tablet that's going to come out. So they recruit the participants. We give the medication to them. Then maybe 15 minutes time, we would check their vital signs. We can do an ECG. We can take some blood. So we can take some blood before we give the tablet, and then we can take their bloods after we have given the tablets to compare and see. Yeah. So
Okay.
yeah,
So that's where the research came from. Like you're actually testing
exactly.
these things. And you made
Exactly.
mention of a particular course that if you
Yes.
had known, you'd have done that course before applying for
Yeah.
a role
Yeah.
in clinical
Because
research nursing. Like this particular course, is it free or we need
oh
to
yes,
pay
it
for
is
it?
free. No, you don't have to pay. If you go to the NIHR website, you can register and do the course. It is free, because the course would give you like insights and overview about clinical research, what you need to do, what is expected of you, what your participants is supposed to know. That because there is something we call adverse events. Maybe you have given this tablet to someone and suddenly the person starts getting a rash, or maybe the person went home and they fell and then they broke their leg. It's an adverse event, but they broke their leg. It has nothing to do with the drug. You can't tell whether it's in relation to the drug or not. So the thing about research is anybody who is registered as a research participant, anything that happens to them, they will have to let you know. Especially maybe if they went to A&E, they were picked up by an ambulance, they fell down at home, whatever, they have to let you know, because we have different types of adverse events. Some of them are suspected, some of them are not also suspected, and some of them are like serious adverse events. Yeah, which
Okay.
has to be documented. Exactly, because it helps us to know that okay, maybe this drug that we are going to bring out, okay, this is going to be like one of the side effects. You get it? Yeah. Maybe if the person says, when I went home, I was feeling very faint, I was feeling very dizzy. So that is how come that all the drugs we are using, we have come to know that, okay, when you take this tablet, this is the side effect. You know, the leaflet we have in the box in most of the drugs. So all of these drugs actually went to clinical trials.
Wow.
So, yes. So we have, if it is first in humans, maybe it's the first time we are trying that drug in humans, it's a phase 1 study. So we pay like critical attention to the particular person who we are giving that medication to. And
Oh,
then we note everything that they would experience down. We do a report and then we will give it to the sponsor. So they also have other people who work on it, and then because they do all these deductions and additions, and then they eventually, there's a body called MHRA. They are the ones responsible for giving license for drugs. So they will look at all the processes that this trial has gone through, how safe it is before the medication is approved. Yeah.
Wow.
So
So
yeah,
so that's really lovely. So all these things they go on in clinical
exactly.
research. Wow.
Yes,
But you did not have any prior knowledge about clinical research nursing and you got the job.
exactly.
So
Yeah,
that means everyone has 100% chance to get
exactly.
the job as a clinical research nurse, even if you have
Exactly.
no prior
If
knowledge.
you have no prior knowledge. Yes. And that is one of the things that I like about the UK and then the NHS, because you don't need to maybe have a degree in a kind of nursing specialty before you move into that area. Once you are able to pass your interview and you move in that area, you'll be taught very well on the job. Yeah. And I'm
Okay.
saying that I should have taken the course because when you take the course, it would explain to you everything you need to know about clinical research. So at least you will gain some fundamental knowledge from the course. Yeah.
But
Because I
does the
remember,
course give you an edge in terms of getting the job?
yeah, so that would help you to get a job. Because when you go to track right now, as we are talking, okay, and you see all these clinical research nurses jobs, okay, you will see that it cuts across. They would ask you that they want someone who has knowledge in ICH, good clinical practice. Every single clinical research job, they are asking for that.
Wow.
And it's in one of their criteria. Yeah,
Oh,
they are
okay.
asking for that.
Wow.
Exactly.
But how is your shift pattern like as a clinical research nurse? Do you do a long day, 12-hour shift?
Okay. So for me, I do just Monday to Friday, 8 to 4. Once in a while, I'll do a night shift, depending on what kind of study we are doing. Because sometimes we need to like observe the participants throughout the whole night. So they come and then they stay overnight, and then we'll get two nurses to do the night shift, and that is like once in a while. But then on a normal day, regularly is 8 to 4. And we even have some people in other units that they do like 8 to 5, Monday to Wednesday, and then they have one day off. And I know some people too, they do 8 to 5, and then they don't go to work on Fridays. And others do they close at 12 on Fridays. Yeah.
That's lovely. But what are the challenges you would say you do face in this specialty? Are there
Okay.
any
So
challenges?
the challenges, yeah. So the challenges are such that you have to do a lot of reading and a lot of writing, because when they bring the research study to you. So the sponsor, we have two types. So I am a clinical research nurse. So I am at the middle of delivering the care, and we have research nurses. So research nurses, they do more of admin work. They work directly with the sponsors. They work directly with research ethics committee, submitting documents for approval and working on all of those things. So they bring the study protocol to us, and then we have to like sit down, analyze the study, and then retrieve all the information from the protocol. And sometimes you can have a protocol with like maybe 100 pages. You have to read it. Yes, you have to read it and then prepare a flow sheet, like summarize everything in the protocol, and then you group them according to the visits. Maybe visit one, when the participant comes, this is what you have to do: height and weight, maybe 10 minutes rest before observations, and then you will have to follow it strictly accordingly, because it is going to affect the result. So if it says that 10 minutes rest, the participant, you have to let your participant know you have to sit down for 10 minutes, no phones, no talking, nothing. They just sit down for 10 minutes, and then after 10 minutes you do the ops and then you record. Sometimes you have to do the ops like 3 times within 5 minutes. Sometimes you have to do an ECG after 10 minutes of uninterrupted rest, and the ECG you have to do it like 3 times within 5 minutes. And then if you it is a day that you are doing dosing, where you are giving the IMP, the investigational medicinal product, it depends on what the protocol says. You can do your ops, you do your ECG, you take your bloods. Then after you have given the medication to, you will have to do the same thing. You do ops, you do ECG, then you take your bloods, and then you will take your blood to the lab. So we have a lab that you, the research would be working there. You take the blood to the lab, and then you process the samples. And that is one of the aspects of clinical research that I really like. Yeah. So you process the samples and then you would spin them in the centrifuge and then you get your serum. So you get your serum, you put them in small aliquots and then you label them. And sometimes it depends on what the protocol says. You have to freeze them, -80 freezer, or maybe -20, or you don't have to freeze them, but then you just have to ship them to the sponsor, just like that, ambient. Yeah. So it's more of reading and then more of writing, but you will have to be someone that, like, you need to pay attention to detail, because this is a research that we are doing. Yeah. And every bit of information really matters towards the research, because the focus is geared towards producing a new drug for a kind of illness. The illness may be existing already, and they may see that, okay, they want to improve upon that kind of medication which is already being used for that illness, or they want to find out how the immunity of people who take this medication is. Yeah. So sometimes it can get busy on some days. I mean, it's a different kind of business. Yeah. Because everything is time point, and you cannot go against the time, because if it says that when you give the medication, maybe it's 7 o'clock, you give the medication at 7 o'clock, you have to take blood at 7:10. 7:10, you are in the patient vein, you are getting your blood out. No delay. Yeah. And sometimes when you take the blood, you have to put it on ice before you can even process it. And that is what the protocol demands. Yeah. So it's kind of, you have to like really pay attention, be very honest with what you are doing, because every little thing really counts in research. Yeah,
Wow. But what's the career progression like in
exactly.
clinical research nursing?
Yes. So there are lots and lots and lots of career progression with being in clinical research as a nurse. Yeah. So I talked about the fact that if you don't want to do bedside nursing the rest of your life, then maybe you have to think about working in clinical research. Yeah. So there are lots of research companies, thousands of them. And then research will never end, because today's research is tomorrow's care for our
Yes.
patients. And all the care that we are giving to our patients now, they are researches which were done in the past by other people, and
Yes.
they have gone through processes and they have been approved as the acceptable standards. So research would never end. Yeah. So when you become a clinical research nurse, so right now, for instance, I have skills in endoscopy, and I gained the skills when I became a clinical research nurse. Yes.
Wow.
Yes, I have skills in endoscopy. I still have my skills as a registered nurse, and then I'm a clinical research nurse as well. Yeah. So you can go into data management, you can go into project management, you can be a clinical research associate. There's something we call monitor. So monitor is like, we are doing a research here, okay? And then you are the monitor, and then you have been employed by maybe a pharmaceutical company, maybe GSK or Novartis or AstraZeneca, it depends. And you would come to my research site where you am doing the research. You
Yes.
come, and then every single data input that I have put down, you come and then you will check. It's more like auditing. Yeah. You check every single one of them. Sometimes too, we have lots of softwares, MS, Redcap, iMedidata, that anybody can access anywhere you are in the world. You just
Wow.
have to log in, because depending on the kind of research and what the sponsor wants us to use, the kind of software, we input the patient's data on the software. So anybody anywhere in the world can access it. You can access it, you as the monitor, and then audit the data as well. So you don't need to even come to the field, okay, to
Wow.
monitor. You can stay in your home and do your job, and then you get your money.
Hmm.
And then if you are a monitor too, and there's going to be a new study that you are the monitor, okay, and you've been employed by the sponsor, you can do your presentation about explaining the research, the protocol, and other things to the clinical research nurses who are going to work on the field online. You do your presentation online from your house, and then you'll be paid. So if you like, you can go online and look for clinical research associate jobs. You will see some of them remote, fully remote, partially remote, you know. So it's something that is very flexible. And aside CRA jobs as well, you can become a specialist in any kind of area, nursing specialist that you like. One of my colleagues, for instance, she's moving to stroke research specialist at the moment as a specialist nurse in stroke research. Yeah. And she's just going to be working 3 days, and then 2 days she will just be home. But she's going to be paid even more than the money she's going to get is even more than what I'm getting. So, I mean, what is the point? You get it. Yeah. And
Wow.
there's another one too who is also moving to Cancer Research UK. So Cancer Research UK is very big, and they are mainly into like cancer researches, because cancer research, oncology research, to
Yeah.
me, I think is the leading department when it comes to clinical research, because there is so much work going on, so much hard work. Like what people are working so hard to find a cure for cancer. And when you are working in the ward or you are not working in clinical research, you will not see it, you will not know, because most of the drugs that we use, we give to the patients, we don't like it's we don't really know how they come about. But this is what clinical research is about. Clinical research, you are working so hard behind the scenes and for the drug to be approved, and then it can be on the market to be given to people to have them, you see. Yeah. So there are a lot and lots of job opportunities if you are working in clinical research. Yeah. And
You
there
mean,
is remote, there is house to house research nurses going there to take bloods from patients and observing patients, and you get your money. That's it. Yeah.
but don't you
Like
have
it's less
challenge?
stressful and it's more money. Yeah.
Wow. But don't you have challenges in terms of getting people to test these products
Okay. So
on, you know?
so there are lots of people who would want to help. So they'll tell you when they come and we ask them, oh, why did you enroll? And like, oh, I just want to help. Yeah,
Oh,
I just want to help. I'll be very happy that, oh, one day it should be said that I partook in this research and I helped to develop this drug, because other people have helped us in a lot of ways. Yeah. Because I tell people all the time, paracetamol did not wake up to become paracetamol
oh
for us
yeah.
to say it is for pain or no. It went through lots of clinical trials before it was accepted and approved that, okay, this is called paracetamol and it is used for pain, because it was tested and proven, like it is evidence based that this one, it is good for pain. So yeah, it has to be used for that. So basically that's it. Yeah.
But in terms of the salary, is there
Yeah,
any special compensation for being
exactly.
a research nurse,
So
a clinical research nurse, or it's just regular NHS pay?
yes. So if you are working in the NHS, okay, it really depends on the specialty and the units that you are working in. But the basic is you will get your NHS pay, but depending on where you are working, you will get something extra too. Yeah. And those who are working in like the private companies, especially, they are earning a lot of money. Because I remember one of my friends was like, oh, she can't wait to finish like her contract, and then because her friend who works in one of these private companies also has a clinical research, and like she had this bonus for the Christmas, a whole lot of things, and then like my friend was just drilling over the whole thing, and I
Wow.
was just telling her it's fine. She should just be patient. Her time will come, Yeah, and they get all these private insurance. Some of them even get like all this car allowance and a whole lot of things. Yeah, so there's a lot of benefits that comes with it. Yeah.
For those aspiring to be a clinical research nurse, what would be your advice for them? Do you think it's a good thing for them to go on with it? What would be your
Exactly.
advice?
Like, exactly. It is a good thing. Like you, Kenny, for instance, I would recommend it for you because now you have a baby, Yeah. And your baby very soon, you have to resume to work and all of that. But the shift patterns are very flexible, because I've had people come to me to help them apply for clinical research jobs, and I have seen some of the jobs that I myself I felt like, oh wow, this is a very good job, because some of them they'll say that, oh, we are very flexible with our hours and we could make arrangements with you and all of that. Yeah. So if you have kids and your kids will go to school in the morning and you have to pick them from school and all of that, yeah, I think that clinical research is good, or like becoming a research nurse is very good, because some of the research nurses, for instance, they don't work on Fridays. Some of them start work at 9 and they close at half 3. Some of
Wow.
them they close at 3 o'clock and then they just go home, and they are getting a lot of money. And some of them too, they don't really have any strict hours they follow. The whole thing is about, this is your workload, anyway and anyhow that you will do it, the manager is happy with it. So it really depends on you, the person, what time you want to come in and what time you want to go. The most important thing is finish your job. Yeah. Because I saw one of these jobs that somebody sent to me, and then the job was, I was like, oh, wow, this is very good. Because in the advert, it said that, okay, flexible hours, 37.5 a week, and all of that. Yeah. But they said, oh, you can choose to start from 10 a.m. to 2 p.m. And I was like, oh, wow, you don't mean it.
That's
10
lovely.
a.m. 10 a.m. to 2 p.m. if you want to. And they stated emphatically, like, maybe if you're a nursing mother, if you, and it, you know that mostly people resume work after maternity and they want to go on maybe 22 hours or maybe 25 hours a week. But this one, normal 37.5, and then you can choose to do 10 to 2 o'clock and then do like the remaining hours at home.
Wow.
Or you can choose to do 8 to 4, Monday to Thursday, and then you take Friday as you're off. Nobody really cares. The most important thing is getting the job done. Because the thing is, like I told you about preparing the flow sheet, you can do that at home because it's mainly administrative work. That
Okay.
aspect is mainly administrative work. Yeah. So you can do that at home. If you take your kids to school in the morning at 8:30 and you come back home, nobody's at home. So you can do your work, and then 3:30 you go for them. Yeah. So it's, some of them are very flexible, and it really depends on you, the individual. And at the end
Now
of the
I'm
day,
feeling
you
like
just,
joining. I
yeah, you
like.
have to. You have to. Yeah. Because like, and you just get the time to do whatever you want to do, and then you use your time how you want it. Yeah. The
Oh,
most important thing is getting your job done for your line manager to be happy, so that it doesn't affect your appraisal. Yeah.
wow, Rosie,
Because
thank
I
you
think
so
initially when I
much.
started, yeah, when I started, for instance, the first week, not even the first day, I was just standing all over the place. And then my manager would say, go and sit down, just sit at your desk. Because I've been working in orthopedics and I'm so used to like standing for the whole day and all of that. He would just say, just go back to your desk and sit down. Like, just go. So, and then people will book GP appointments in the morning, 8 to 9, and they'll come at 9. And then I would just be like, oh, okay, I see. Because when you're working in the GP appointment, you have to do it on your off day. You can't just go and do a GP appointment on a day that you are working and then leave work and go for GP appointment. No, you know what I mean. Yeah. So I found it, I was like, oh wow, this is really good. And then there was this lady that I think her husband traveled back to go home. She's from Asia or something like that. And then she was coming at 9:30 every day because she was taking her kids to school in the morning. And she would come and then she would do her job very well. And then 4:30, she would go home. And I used to be very surprised initially, but then as time went by, I think I understood it better. Yeah. So
Wow.
yeah,
I'm
because
so happy I came across you. Like,
I
you're already
know.
giving me good information and something
Yeah,
to make me look into this particular
yeah.
special.
You have look into it. I would say look into it.
I see
Look
a lot
into
of it on track job, and I'm like,
Yeah,
do I really
yeah.
want to do this?
Do this exactly. Yeah. and it's
Oh,
and it's not stressful, because it's more about being very tactful and paying attention to detail, and then sticking to what your protocol says, like just doing like ABCD as it has been listed over there. Yeah.
Wow.
Because some of the specialist research nurses, for instance, they just stay home, call the participants, follow up on them, and they write the report whilst they are home. And then they get paid. Yeah. I know.
Oh, this has been very educative and
you know,
informative.
people who participate in the research, like they sign up for the research and all of that, they get paid for partaking in the research.
Oh,
Yeah.
wow.
Some of them, they get paid for their fuel, their some of them even pay, depending on the research, some of them even pay for their travel tickets, their food that they would eat when they come, and all of that. Yeah, and they actually get paid for attending the visit. Yeah.
Oh, thank you so much, Rosie. Thank you.
Welcome.
I'm so glad. I can't, I'm so happy. I'm so happy that you came to my channel. Guys, if you have any more questions that you think we haven't touched, please leave it in the comment section. I'll get Rosie to please reply them. I'll get out like one way or the other. I will try and get her to please reply these things. But thank you so much. Thank you for honoring my invitation. I am so